Good afternoon, everyone. I'm Dr. Mayuresh Kishore Sawan, proud member of the Gurukul Global Ayurveda Academy. And it's a pleasure to welcome you all for this session. Well, at Gurukul Global Academy, our mission is to build a future healthcare. Each learning experience over here is designed to specially shape the Ayush doctors in globally competent professionals within the reach of strong ethical and academic foundations. The institution aspires to become a pioneer in holistic education, guiding the aspiring students for achieving the best of excellence in Ayurveda and allied science. Today's session is very special. It's about the clinical approach towards the cirrhosis of liver. Well, I must say we are very, very lucky that we are having one of the honored and most renowned personality in this specific field, Dr. Chinmay Phondekar, MD in Ayurveda. Warm welcome to Vaidya Chinmay. Before starting up the session, let us join our hands together for the Dhanvantari Seven.
नमामि धन्वन्तरीरादिदेवं सुरासुरवन्दितपादपद्मं लोके जरारुक् भयमृत्युनाशम् दातारमीशम् विविधौषधीनां शङ्खं चक्रं जलौकां दधतमृतघटं चारुदोर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिरुद्यं शुकपरिविलसन् मौलिमं भोजनेत्रं कालाम्बोदोज्ज्वलाङ्गं कटितटविलसच्चारु पीताम्बराढ्यं वन्दे धन्वन्तरिं तं निखिलगदवन् प्रौढदावाग्निलीलं प्रौढदावाग्निलीलं प्रौढदावाग्निलीलम्.
Om Shanti. I humbly request Dr. Datta Bapadikar sir to take over and continue the session.
My slides are visible.
Yes, sir.
Okay. I welcome you all in today's clinical session, the Gurukul Global Academy. I just brief about the Gurukul Global Academy first. We have the mission of building the future of healthcare. We offer you 25 plus super specialty courses in Ayurveda with the integration of Ayurveda and modern science. We conduct clinical meetings twice in a month, which is for free for all Ayurveda learners. We conduct workshops, hands-on training and conferences. You can visit our email, our Facebook, our WhatsApp for more details. These are our upcoming courses, especially integrated oncology, essential pharmacology, rheumatology, Vikruti Vidyan, Rasa Shastra, Panchakarma, Dravyagun Vidyan. I welcome you all in our today's clinical lecture. Our topic is physician's approach towards cirrhosis of liver. And it's my honor to introduce our today's guest speaker. Our today's guest speaker is Dr. Chinmay Phondekar. Sir has passed BMS from APM's Ayurveda Mahavidyalaya, Sion, Mumbai. Sir has done master degree in Rasa Shastra and Bhaishajya Kalpavruksha from R.A. Poddar Medical College, Worli, Mumbai. Sir is a founder and managing director at Shailiya Rasashala and Pathyam Nutritional Care. Sir has a special keen interest in gastroenterology and hepatology. Sir conducts online lecture series on hepatology in Ayurveda since June 2020. Sir has felicitated with Jivak Puraskar by Himalaya Healthcare for academic excellence. Sir is approved as a co-guide for PhD in pharmacology in the capacity of subject expert. Sir has published various research papers specifically on topic of Wilson's disease in pediatrics, pharmaceutical evaluation of Kumariasav, progression of liver diseases through Ayurvedic perspective. So I request to start your session towards you, Dr. Chinmay sir. Dr. Chinmay sir, please share your screen.
Is my screen audible, visible?
Visible. Visible. So please start.
नमस्ते शारदे देवी वीणा पुस्तकधारिणी विद्यारंभे करिष्यामि प्रसन्ना भव सर्वदा. Om Tat Sat. Good afternoon to all. Today's our topic is clinicians' approach towards liver cirrhosis. Actually, there is some error in the presentation which I have made for today's session, but anyway, I am from starting from another device. Case number 1. Before starting our presentation, we will see 3 cases. Case number 1, 30 years male patient comes to your OPD. He has an icterus, loss of appetite, weakness, bilateral pedal edema, and ascites. Tapping done for this case. This is since patient is suffering from 2 months, and on examination there was mild hepatomegaly, so splenomegaly 1 plus below coastal margin, and shifting dullness. He had no drug history or family history, but he had a history of alcohol consumption since last 12 years. See, this patient is a 30 years old male and he has a alcohol consumption since 12 years, right from 18 years of age. No other significant findings were observed. His initial LFT was serum total bilirubin 6.2, HGOT was 84, serum albumin was 2.5. Hemoglobin was 8.6, RBC, WBC is 11,000, which marks some question mark. Prothrombin time was 40.3, which is very, very high. Occult blood was positive. Blood's bile salts and bile pigments were absent. This was his initial ultrasound. There were changes of cirrhosis, mild splenomegaly, prominent portal vein, portal hypertension was there, and due to this portal hypertension, there was reactive gallbladder wall edema. This is a case of alcohol associated cirrhosis. Case number 2. 63-year-old male brought to your OPD. This is a known case of ulcerative colitis, which he was under allopathic treatment and suggested for liver transplant. He was having ulcerative colitis along with chronic liver disease or liver cirrhosis. Complaining of loss of appetite since 4 months, bilateral pedal edema since 15 days, giddiness intermittently, vitals were stable, mild splenomegaly was there. This was his initial LFT. Hemoglobin was 8.3, serum ammonia was 294, which was high. Prothrombin time was within range, 13.9. Occult blood was positive. These were his endoscopic findings, and like esophageal varices, gastric varices, and rectal varices, all 3 were present at that time. This is a case of cirrhotic liver with moderate splenomegaly, dilated portal vein, and collaterals were observed. This was a case of portal vein thrombosis with chronic liver disease. This was his intermediate ultrasound. You can see here this initial and recent findings on ultrasound. The residual wall thickenings of portal vein and left branch thrombosis persist. Case number 3. Since I have very short of time, I have to go fast. 23-year-old female brought to your OPD known case of autoimmune hepatitis complaining of icterus since 2 months, weight loss of around 5 kgs in 2 months, past history of amenorrhea since 6 months. This was started, this case rather complaints were started from amenorrhea. On physical examination, vitals were stable, mild icterus. This was his LFT. Prothrombin time was 21.3, which was again high. INR was 1.78. This is a case of autoimmune cirrhosis, autoimmune hepatitis turned to cirrhosis. Now, from all these cases, there are various question comes in my mind whether Vyadhi Avastha is important or Vyadhi is important, like liver cirrhosis, label is important or Aushadh is important. This question comes in my mind. This is a famous Loeb's law of therapeutics. We should remember this. If what you are doing is working, keep doing it. If what you are doing is not working, stop doing it. Patient should not get hampered. If you don't know what you are doing, do nothing. And lastly, never make treatment worse than the disease. Now, what is cirrhosis? Irreversible diffuse fibrosis of liver with formation of regenerative nodules. It is defined by there is a fibrosis in the form of delicate bands or broad scars, septa, nodules, regenerating nodules, or it is a reaction of the injuries happening in the liver, regenerating hepatocytes encircled by a fibrosis with diameter varying from very small, either it is micronodular or macronodular or mixed type. And third is disruption of the architecture of the entire liver. What is fibrosis? It is a delicate band of broad scars or septa happening after hepatocyte injury. Fibrosis is the key feature of progressive damage of liver, and once cirrhosis has developed, reversal is thought to be rare, or we have to make great efforts to make it reverse. Liver fibrosis, it is a vascular architecture is reorganized due to parenchymal damage and scarring. I'll show you later. In the formation of abnormal interconnections between vascular inflow and hepatic vein outflow channels. So, in short, vascular architecture is reorganized in cirrhosis, or it is disrupted. So, these are the key factors in pathogenesis of liver cirrhosis: nodularity, regenerating nodules, fibrosis, abnormal liver architecture, hepatocytes abnormalities, and gross pathology like on your clinical examination, irregular surface, on palpation, small, firm. This kind of key factors in the pathogenesis of liver cirrhosis. So this is a normal healthy liver and this is a fibrotic liver. Here you can see vascular architecture is disrupted, it is reorganized. So sinusoidal pressure is increased. In the vascular pressure, vascular resistance is increased. So it is causing portal hypertension. Deposition of collagen around the central vein. So vascular resistance increases and portal finally results in portal hypertension. Few things I have to skip now. Clinical features: all forms of cirrhosis may be clinically silent. If patient is symptomatic, what are the symptoms like anorexia, weight loss, weakness, osteoporosis, frank debilitation? This is a stigmata of chronic liver disease, like coma, fetal hepaticus, spider nevy, gynecomastia, jaundice, ascites, loss of sexual hairs, testicular atrophy, flapping tremors, bleeding tendency, anemia, melena, portal hypertension, varices. All, these are all stigmata of chronic liver disease. In either way, patient comes to your OPD with these symptoms. So ultimate mechanism of most cirrhotic deaths are due to progressive liver failure, complications related to portal hypertension, and thirdly, development of hepatocellular carcinoma. So first two are more important: progressive liver failure and complications related to portal hypertension. If patient is not treated well, it turns to portal hypertension. There are many complications arising due to not taking medicines or negligence. Now, complications associated with cirrhosis like hypoalbuminemia, like from decreased synthesis of albumin, decreased synthesis of plasma proteins, and hepatic encephalopathy due to reversible. It is a reversible metabolic disorder from increase in serum ammonia or portal hypertension or variceal bleed. Complications associated with cirrhosis like hepatic failure. This is the end point of progressive disease. Patient can have bleeding diathesis or patient can be hypercoagulable. These are two kind of pathologies happening in these coagulation defects. Second is portal hypertension due to resistance of intrahepatic blood flow due to intrasinusoidal hypertension and anastomosis between portal vein tributaries and arterial system or collaterals are developed. So what are the complications like ascites, esophageal varices, congestive splenomegaly, periumbilical venous collaterals, caput medusae? So in a nutshell, liver cirrhosis, it is the end result of diffuse liver damage. It is characterized by diffuse loss of architecture, fibrous bands and regenerating nodules, and distort and obstruct blood flow, hepatocellular insufficiency and portal hypertension, and shrunken, scarred liver, splenomegaly, liver failure, and CNS toxicity. This is all scenario of liver cirrhosis. So cirrhosis with portal hypertension and cirrhosis with liver insufficiency, like with portal hypertension, either variceal hemorrhage or ascites, it can turn to encephalopathy also. So in Ayurveda, in Nidan Panchak, if patient comes to your, what do you come to know from Rupa or Nidan, any Purva Roop? So it is useful in व्याधि व्यवच्छेदार्थ, चिकित्सार्थ, साध्य साध्यत्व and हेतु निश्चितीकरण. If patient comes with nakhanayana pitata, jaundice or icterus comes to your OPD, then we should be able to make differential diagnosis from Ayurveda point of view. I'll show you later. चिकित्सार्थ तत्र पूर्वरूपदर्शने ज्वरादौ वा हितं लघु अशनम अपतर्पणम वा. This is mentioned in चरक निदान स्थान ज्वर अध्याय. To make proper chikitsa, we come to know from Purvarupa Darshan, Sadhya Sadhyatva or prognostic point of view. This is important. And Hetu Nishtitikaran. We all know Pandurogi Tuyo Atyatam Pittalani Nishevate. If this kind of scenario comes to you, so Pittala Ahar Vihar ka is Bahu and turning to Bahupitta Kamala, then we should stop. We should ask him to stop the Pittala Hetu Sevan. So this is a Ayurvediya Vyadhi Vyavached Haridra Netra. It can be from Majjagata Pitta Prakopa, Paitika Udara, Pitta Jajwara, Kamala, Rakta Pitta Purvarupa, Kshina Vayu, Pitta Sama and Kapha Vriddhi Avastha, Paitika Arsha, Pittaja Visarpa, Paitika Pasmar, Paitika Unmada, Harita Netra. Like from Pittaja Jwara, Pittaja Gulma, Paitika Udara, we all can see these kind of patients in our OPD like Paitika Udara. Yes, these kind of patients exist. Pittaja Gulma. This kind of patient exist. Just we have to see whether it is a Gulma or Udara or any sort of then Vataja Gulma, Pittaja Gulma, Kaphaja Gulma. We have to see this. Pittaja Jwara, Pittaja Pandu, Halimaka, Pittaja Arsha, Bhekavana, Vatabala. It is mentioned in Vatabalasaka Jwara also. Kamala, Raktaja Arsha, Haridra Varna Nakha, Majjagata Pitta Prakopa, Paitika Udara, Paitika Gulma, Pittaja Jwara, Kamala, Rakta Pitta Purvarupa, Haridra Varna Twaka, Paitika Udara, Paitika Gulma, Pittaja Jwara, Paitika Madatye, Pandu, Kamala, Rakta Pitta Purvarupa, Paitika Visarpa. Again, Haridra Varna Mukha, Harita Varna Mukha, Haridra Varna Mutra, Pita Varna Mutra, Krishna Varna Mutra. Yes, this is a Krishna Varna. In reality, we see this Krishna Varna Mutra also. Whenever you are treating a patient of liver disease, always try to examine Mutra Pariksha or ask patient to do collection of every urine of everyday urine and ask him to keep samples. वातज स्वरभेद, वातज गुल्म, वातज पांडू, असाध्य कामला, रक्तवर्ण मूत्र. So urine examination is very important in liver disease. There is light yellow, umber colored urine, brown colored urine. If urobilinogen is absent, then it is obstructive jaundice. If it is present, then hemolytic jaundice. Bile salts. We must do urine examination of every cirrhotic patient, whether bile salts are present or bile salts are absent. These are very, very important in treating or starting Snehapan. Shvetavarna Purisha, Pitavarna Purisha. This is stool examination, Ayurvediya Purisha Pariksha. These are Shvetavarna Purisha. We should differentiate between Shvetavarna Purisha, Tila Pishtaniba Purisha, Pitavarna Purisha from beautifully Ayurvediya Parikshan is given in our text. Just we have to search for it. Occult blood, if occult blood is present, then it can be because of variceal bleeding or GI malignancy or esophageal varices. Now diagnosis of cirrhosis is made on 4 parameters like clinical, laboratory examination, radiological examination and liver biopsy. In whom should we suspect cirrhosis? Any patient with cirrhosis, any patient with chronic liver disease whose aminotransferases or alkaline phosphatases are high. Physical examination findings like stigmata of chronic liver disease, which we have seen, palpable left lobe of the liver, small liver span, splenomegaly, signs of decompensation. Again, laboratory examination, low albumin. Low albumin is an alarming sign. Albumin level should not go below 3 or to maximum 2.5. It should not go beyond below 2.5. Prolonged PT, increased INR, high bilirubin, and low platelet count. See, thrombopoietic function is deranged in liver disease, so platelets are normally low in case of liver disease patient. So don't go for increasing platelets and start these these are going to be a low. AST-ALT ratio, if it is more than 1, then it is a cirrhosis. These are gradations of liver fibrosis. Most commonly, this fibroscan non-invasive marker is done nowadays. If it is more than 12.5 kPa, then it is cirrhosis. It is F0 to F1, then F2, F3, and if it is F4, F4 is cirrhosis. This is a diagnostic algorithm. Patient with chronic liver disease and any of the following like variceal hemorrhage, ascites, hepatic encephalopathy comes to you, then liver biopsy not necessarily for the diagnosis of cirrhosis. If it is absent, then physical findings like enlarged left lobe of the liver, splenomegaly, or stigmata of the chronic liver. Radiological findings like small nodular liver, ascites, intra-abdominal collateral, splenomegaly, and colloid shift to spleen and bone marrows. This is very important point in case of cirrhosis. First, we have to see whether it is compensated or decompensated. Compensated means liver is damaged, but still it can perform many important bodily functions. With great efforts, it can be reversed. This is a compensated cirrhosis. Energy needs should be increased by 20 to 40%. And what is decompensated? Liver, it is life-threatening condition. Liver is damaged, but either it is too late or we have to make too much efforts, but not surety. This is a decompensated cirrhosis. Like portal hypertension is there, PT is increased, INR is increased, bilirubin is more than 20-25, INR PT is more than 30, albumin is less than 2. This is a decompensated cirrhosis. Ascites is there. This is a decompensated cirrhosis. Now, signs of decompensation like jaundice, ascites, portal hypertension, esophageal or gastric varices, hepatic encephalopathy, evidence of GI hemorrhage. PR examination is very important in case of any type of hemorrhage, like PR bleeding. Bruising suggests coagulopathy and fetor hepaticus. In our text, in Kumbhakamala, कालांतरात खरीभूता कृच्छ्रा स्यात् कुंभकामला. Kalantarat means avasthantara. There are 4 gradations in case of fatty liver to cirrhosis. So it is the avasthantar. Kumbha means antar saushirya sadharmyat koshtha. It is mentioned in Madhukoshatika. Here you can see saushirya decellularized liver in last 2 images. Distance between 2 cells is increased. खरीभूत means काल प्रकर्षा खरीभूतो जरठताम गतो न सिद्ध्यति. जरठताम means stiffness. गतो न सिद्ध्यति. This is असाध्य अवस्था. अचिरोत्पन्नो अपि शूनानां मध्ये यो वा पीतानि पश्यति. This is mentioned by Jejjat. अचिरोत्पन्नो acute phase. अपि शूनानां मध्ये यो वा पीतानि पश्यति. शूनानां Shotha is there. He sees everything yellow. Means this is asadhya avastha. And third is mentioned by Chakrapani. Chirotpanna kharibhuto atyartha rukshito sarvadhatu na siddhyati. Chronic stage. Chronic liver disease. Kharibhuto. Fibrotic stage. Atyartha rukshito sarvadhatu na siddhyati. Asadhya avastha. Again, these are a stigmata of chronic liver disease. Bala, Utsaha, whatever the symptoms we have seen is mentioned in Charak Samhita and Madhav Nidan. Bala, Utsaha, Kshayo Tandra, Mandagnitva, Mrudu Jvara, Strishu Aharsho, Angamardasha, Shwasa, Trushna, Aruchi Brahma. Again, in cirrhotic or decompensated cirrhosis, Krishna Pita Shakrun Mutro, Vrusham Shunasya Manava, Saraktakshi Mukha Chadi Vinmutro Yashyatamyati. Daha Aruchi Trusha Anaha Tandra Moha Samanvitaha. We all can see this type of symptoms in our patients. Bahupitta Kamala. Pandurogi Tuyo Atyartham Pittalani Nishevate. तस्य पित्तम अश्रुक मांसम दग्ध्वा रोगाय कल्पते अत्यर्थ पित्तल आहार सेवन can turn to rakta and mouse dagdavastha. Here you can see bahupitta kamala turns to rakta and mouse dagdavastha, then it turns to pakavastha. Vrana is developed. If it is not treated properly, in that kharatva is developed and there is a shoth in hepatocytes. This is finally kharibhuta yakruta kumbha kamala stage or fibrosis of liver. Here you can see the stages of liver damages. Madatyajanya pak. Mentioned in Kashyapa Samhita. Sroto pako. ज्वरोदाहो विडभेद स्वेद पीतता छर्दी रक्त प्रकोपो वा पीतम पश्यति पैत्तिके. There is a park of entire Srotas. Chardi Rakta Prakopo va Pitam Pashyati Paitike. He sees everything yellow. Udara Pittaja Udara Kshiprapakam cha bhavati. Kshiprapakam means Shigrapaka Jalodaratam yati. This happens in SBP, spontaneous bacterial peritonitis, Pittaja Udara Avastha or Kshiprapak. Krishna Pita Shakrun Mutro, Krishna Pita Mutra, Krishna Pita Shakruta, Krishna Pita Shakrun Mutro, Bhrusham Shunascha Manavaha, Saraktakshi, Mukha Chardi, Vind Mutro Yashatamyati. Everything is mentioned in our text. Nashtagni Saudnya Kshipram hi Kamalavan Vipadyate. Nashtagni Saudnya, it is not Mandagni Saudnya, it is Nashtagni Saudnya. Agni is getting vanished. This especially this happens in case of hepatic encephalopathy or end stage of liver cirrhosis, end stage of liver disease. I'll go forward. There are two clinical conditions in case of portal hypertension. One is portal thrombosis or thrombocytopenia with hepatosplenomegaly and collaterals are developed. In this case, you can use Tamrabhasma, Kamalanalkshar, Guduchi Churna and Patha Churna. There is every dravya has some logic and you can use here as a Triantyadikvat as Anupan. Triantyadikvat is given in Ashtanga Hruday and clinical condition 2, portal hypertension, portal wall thickening, non-bleeding and low hemoglobin. Here you can use in case of instead of Tamra Bhasma, here you can use Kasisa Bhasma. Tamra Bhasma, it is a Madhurpaki, Pitta Kafagna, Urdhva Adha Parishodhanam, Vishahara and Lekhan. In Kumbha Kamala stage or Kharibhuta Yakruta stage, we have to do Lekhan. At the same time, it should be Madhurpaki. Same like Suvarna Bhasma. Tamrabhasma is Madurapaki, Pitta Kafagna, and it is Paramalekhan. Gulma, Pliha, Yakrut, Kshaya, Agni Sadanam, Meham Chumulamayam, and Kasisa Bhasma, it is Kasis is a Rakta Sanjananam Param. Ama Sanshoshanam Srishtam, Mandagni Parideepanam. Which karma are expected from Yakrut in our liver cirrhosis? It should be Yakruta Pitta Sravaka, Yakruta Shothahara, Rasayana, Virechaka, Rakta Prasadana, Vishagna, and Vayasthapana. Few points I'll mention here. Virechana, like Kamala, there is a difference between Virechana in Kamala, Udara, and Adhobhaga Shotha. In Kamala, Virechan is Mrudu, Tatra Pandvamai Snigdha Tikshnai Urdu Anulomikaihi, Sanshodyo Mrudubi Tiktaihi, Kamali to Virechanaihi. Udara, in Udara, Virechan is Tikshna or Nitya Virechana, Abhikshna Virechana. Dosha Atimatra Upajaya Sroto Marga Nirodhana, Sambhavati Udaram Tasmad Nityameva Virechat. All Kalpa, Virechan Kalpa, Virechak Kalpa are Tikshna in nature. अधोभाग शोथ अधोभाग अधो विरेचने ही उपाचरे. Like not only Purusha Virechan is here expected, but also Mutra Virechan is also expected. Like Punarnavashtakvat, Punarnavadikvat, there is a slight difference. Haritakyadikvat. In Purusha Virechan, Narayana Churna, Abhrayadi Modak, Patoladi Churna you can use. पटोलपत्रम पित्तग्नम नाड़ी तस्य कफापः फलम तस्य त्रिदोषग्नम मूलम तस्य विरेचकम. पटोलपत्र you can use in Kamala and Patolamula you can use in Udara for virechan. Like Patola Katurohinyadikvat, Patola Muladikvat and Patola Muladi Churna can be used in liver cirrhosis. This is important reference. धातु नदीजम जतुशैलजम वा कुंभावये मूत्र पिबेद वा मूत्रयुतम पिबेद वा मूत्रम स्थिते सैंधव संप्रयुक्तम मासम पिबेद वा अपि हि लोहकिट्टम. Like Suvarna, Acharya Sushrut has mentioned only 3 dravyas in Kumbha Kamala, like Suvarna Makshik Bhasma, Shuddha Shilajita, and Mandura Bhasma. Suvarna Makshik Bhasma, it is a Pandu Shothahara, Jirna Jwara, Apasmarahara, Parama Yogavahi. Mandura Bhasma, you can see Falashruti of Mandura Bhasma, like Mandura Bhasma is useful in Pandu, Shwetu, Shoshajit, Halimakam, Kamala, Plihanam, Kumbha Kamala. All clinical conditions are mentioned in Falashruti of Mandura Bhasma. Shilajita, Sajvara, Pandu Shopashamanam, Meha Agni Mandyapaham, Meda Chedakara Pliha. So, if we combine all these 3 drugs like Suvarna Makshik Bhasma, Mandura Bhasma, and Shilajit, we get our famous kalpa Tapyadi Loha. So it is Visheshat Hanti Apasmaram Kamalam Gudajanicha. Recently we have done one PhD work in Tapyadi Loha on Tapyadi Loha in hepatic encephalopathy. It is internationally appreciated that our work, it was animal study plus clinical and preclinical study. Again, Rajata Bhasma, it is Uttama Vayasthapana Dravya, Parama Rasayana, Brahmahari, Pittamaya Prashamanam, alcoholic cirrhosis, helpful in alcoholic cirrhosis like Madakya Atyakaram, Vannimandya Pranashanam, Vishagnam, Plihodara Vinashanam. Vaikranta Bhasma, आयु प्रदश्य बल वर्ण करो अतिवृश्य. It is helpful in Pandu, Udara, Jwara, Shwasa, Kasa, Kshaya, Pramehanam. Shall I talk for next 5 minutes?
Sure, sir.
Okay. Abraka Bhasma. It is a Parama Amruta Vata Pitta Kshaya. Whenever samprapti of liver cirrhosis is vata pitta adhikya, then you can use, especially in case of autoimmune cirrhosis, it is observed like SGOT, are increasing rapidly. Hepatocytes are getting damaged. That time, Abrak Basma can be used. Balya, Snigdha, Deepana, Shita Virya, Vaikranta Basma 60 mg. This combination I generally use. Vaikranta Basma 60 mg, Abraka Basma 125 mg, Amalaki Churna 500 mg, and Guruchi Churna 1 gram. Vardhaman Pippali Rasayan, it is also helpful. The only criteria I follow, patient should not have portal hypertension. स्वरियम आयुष्यप लिहोदर विनाशनम वयस स्थापनम मेद्यम पिप्पलीनाम च रसायनम. कालमेघ is also good द्रव्य. बालानाम यकृतोदरस्य प्राग्भाव परिपालनार्थम means it restores its architecture of liver. So it is कालमेघ बालानाम कासे श्वासे. In Virechan form, it can be given. Also, in Shakashrita Kamala, Dosha Sangata Bhedan. Helpful in Dosha Sangata Bhedan. Haritaki. Punarnava. Sroto Vibandam. Punarnava acts like Sroto Vibandam Nashayati, Agnim Deepayati, Rasaraktadi Dhatunam Vahanam, Samyak Karoti, तथा च मूत्र पुरुष स्वेदान सम्यक बहिर्निस्सारयति. Drakshadi Kasha is helpful in alcoholic liver disease. When albumin level is getting dropped, Draksha Kvat can be given. Also, Drakshadi Leho is helpful in fibrotic changes. Yakrut is not given in any marma or pranayatana, but Yakrut is the main site of Raktavaha Srotas. So it is Rakta comes in Dasha Pranayatana. So it is a vital organ. We must remember we are treating a vital disease of vital organ and treat accordingly. Suvarna. Vishagaraharam, Bruhanam, Vrushyam Agram. It is similar to like Tamra. Also, like similar means it is Madhuro Vipaki, Lekhan, Vranagna also, and Balya. ओजो धातु विवर्धनम बलकरम पांडवामय ध्वंसनम सर्व विशापहम गरहरम. सुवर्णकल्प like सुवर्ण मालिनी वसंत सिद्ध मकर ध्वज त्रैलोक्य चिंतामणि रस can be given. निहंति आशु जरा मृत्युम न संशय. हलिमक उदर और जलोदर. This set of symptoms can used in this kind of set of symptoms. Knowing as much as possible about your enemy, like your disease or liver cirrhosis, precedes successful battle, and learning about the disease process precedes successful management. Thank you very much for patient listening. Since it is a presentation of overall 3 hours, but I have to wind up in or deliver in 40 minutes. Whatever possible things I have delivered. Thank you very much for patient listening, and thank you very much to Dr. Datta Papadekar sir for giving me and this opportunity.
Thank you, sir. Sir, one request, please stop your sharing.
Okay.
Now moving to question answer session. Sir, first question is how to differentiate clinically non-alcoholic fatty liver disease and liver cirrhosis? Sir?
Yes, yes, yes.
How to differentiate clinically non-alcoholic fatty liver disease and liver cirrhosis?
Non-alcoholic fatty liver disease is many a times it is asymptomatic or accidental finding. Like rather grade, there are three gradations: grade 1, grade 2, grade 3. Grade 1 is generally asymptomatic. Grade it takes much time from going from grade 1 to grade 2, almost 3 to 4 years, and but less time from grade 2 to grade 3 in case of non-alcoholic fatty liver disease. Now it terminology has changed now, MASLD. And in case of cirrhosis, alm exactly reverse condition is there. It is many a times it is symptomatic.
Okay,
A
okay,
very high, very one or two cases are asymptomatic. Otherwise, it is symptomatic.
okay. Thank you, sir. So our next question is, please elaborate about Trayantadiquat.
Triantheriquat, yeah, it is mentioned in Ashtanga Hriday. Uh, I think in Gulma or Visarpa. I'm not remembering properly now, but it is helpful in Arbudaka condition, or whenever there is a thrombosis along with your drug. I use generally Tamrabhasma, uh, Patha, and Trikatu along with Trianthadiquat, or sometimes Varunadiquat. It depends on clinical condition.
Thank you, sir. So our next question is, as you mentioned, there is a small difference between Punarnavadiquat and Punarnavashtaquat. So can you please elaborate?
Yeah, please refer Bhaishajya Ratnavali.
Okay. Is there any clinical condition where to use Punarnavadiquat and where to use Punarnavashtaquat clinically?
Clinical condition.
Yes.
Punarnavashtaquat, like whenever there is a hepatorenal syndrome or Shotha, and other पुनर्नवा अभय निंब दारवी तिक्ता पटोलक ही गुडूची नागर युत ही क्वाथो गोमूत्र संयुत पांडू कास उदर श्वास शूल सर्वांग शोथ that times, or uh, what what can say, like when albumin is less, and that time it can be given. The shoth is more and albumin is less. There is a one question like compensated and decompensated treatment success rate with Ayurvedic treatment. It is success rate is very good in case of compensated cirrhosis, but sometimes we have to take a help of allopathy in case of decompensated cirrhosis. But in both cases, success rate is very good if treated properly according to Vyadhi Avastha.
Thank you, sir. We appreciate your work and your knowledge, sir. Now we are moving to chairperson session. It is my honor to introduce our today's chairperson, Dr. Pankaj Tathed, sir. I welcome you, sir. Sir is currently working as an associate professor and head of the department in the Department of Panchakarma, APM's Ayurveda Mahavidyalaya, Sion, Mumbai. Sir is a MUHS approved UG and PG and PhD guide. Sir has published various research articles. Sir has taken active participation in national and international seminars, conference and workshops. Over to you, sir. Pankaj, sir.
Hello.
Yes, sir.
Hello.
Yes, yes, sir. Sir, you are audible.
Yeah. Uh, yeah. In Ayurveda, liver cirrhosis can be understood under the Adhyay Udar. Its anatomical, metabolical, and functional disturbances can be understood keeping an eye on the dosha, dhatu, strotasa, and causative factors, and according to which we need to treat. In nutshell, I can say the use of Arogyavardhini, Punarnavashtakvat, Varunadiquat along with the other medicines as per the need. We can give relief to the patients we treat by Ayurveda. Thank you, everyone, for your active participation in today's online clinical meeting on liver cirrhosis. It was a truly enriching session explaining valuable clinical insight and evidence, also case based discussion. It was need of the hour to review the discussion, early diagnosis, challenges in the treatment, and complication we face while treating the liver cirrhosis. I want to express my sincere appreciation to our presentee, Dr. Chinmay Phondekar, for his valuable insights. To all the attendees, thank you to the Gurukul Global Academy for giving the opportunity to us. Moving forward, we must encourage each and everyone to be part of such fruitful clinical meeting and to apply the knowledge gained here in our Ayurvedic practice. Thank you. Thank you very much.
Thank you, sir, for your expert talk. Moving ahead, I just brief about our upcoming courses. So we offer certificate course in integrated oncology. That would be given by Dr. Nitin Kochar sir, Dr. Viraj Nevrekar sir, Dr. Namrata Bhagat madam, Dr. Ram Nag, Dr. Samar Gupte, Dr. Prashant Amrutkar, Dr. Mitali Mukherjee and Dr. Rishi Agarwal. Essential Pharmacology online course will be taken by Dr. Nimish Narkar sir. Sir is currently Assistant Professor in Department of Pharmacology, KJ Somaiya Hospital, Sion, Mumbai. Essential Dravyagun Vidnyan by Dr. Prajakta Patel madam and Dr. Swagata Tavre madam. Essential Rasashastra and Bhaishya Kalpana course will be taken by Dr. Madhav Bide sir and Dr. Ketki Bide madam. Rog Nidan Vikruti Vidnyan, Essential Nidan and Vikruti Vidnyan taken by Dr. Anish Pandit sir. Essential Panchakarma course will be taken by Dr. Monica Mule madam, Dr. Ravi Bhushan Sonavane sir, Dr. Deepali Chavan madam. Therapist Panchakarma training course and also rheumatology course. Basic life support, this will be offline hands-on training by Dr. Abhijit Kore sir. We just brief about our upcoming events. That is a clinical meeting that would be on 4th of December. The topic would be Yukti Sattva in psychiatric disorders. Guest speaker is Dr. Cyril Kadam sir. Next, our session would be on 18th of December by Dr. Rucha Pai madam. Topic would be clinical case series on the non-surgical management of lipoma. We will start our Ayurveda knowledge journey with our first day of 2026 with Dr. Santosh Mahadik sir. Topic would be various cases of Vata Rakta in day-to-day practice. Now coming to the vote of thanks session. I appreciate and my gratitude towards Dr. Chinmay Phondekar sir for deep insights in liver cirrhosis cases. Our chairperson Dr. Pankaj Tathed sir. I deeply appreciate our introductory session taken by Dr. Mayuresh. Our special thanks to Ayurvidya Kalpashala and Pillcraft. I also sincere thank to our technical support team, Mr. Yash and Ms. Namrata madam, and our founder, Dr. Bharati Chandra Mahamuni sir. I conclude here our today's session. Please keep in touch with the Gurukul Global Academy in social media. Thank you.